As the surveillance continues across the country for COVID-19, Belizeans are asked to monitor themselves for any flu-like symptoms. But what does this mean? To understand the symptoms of the new disease, we must know how this new virus affects the body.
The COVID-19 is like a tennis ball, no?
Okay.
With different spikes. And what is happening with this one in particular is that, as we know, they need us to be able to be transmitted to basically to infect other people. The virus need us, and then two things can happen. These spikes, one, we touch our faces, then attach to our nose, but most importantly, the spikes go to attach to the cells in the lungs.
The lungs are vital organs. We use them to breathe and enrich our body with much needed oxygen. Dr. Jorge Hidalgo is an intensivist, which means he provides care for the most critically ill patients.
Most of the cases, 80% of the cases, it could be they have no symptoms or they will have a very, very minimal symptoms. Then when a situation like that, when we start to experience respiratory problems, the main symptoms is cough, fever, and of course, shortness of breath.
Scientists are learning more about this new virus daily. Some of the preliminary data from studying China's outbreak that started at the end of last year tells us more about the symptoms of COVID-19. Firstly, it can take anywhere from 2 to 14 days before symptoms may start to appear. The most common symptoms are fever, cough, and breathing problems. Some persons may have body aches, stuffy or runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. There are some who may become infected and do not develop any symptoms. Being asymptomatic, having no symptoms, can lead to the spread of the virus to others without even knowing it. And some people are at a higher risk for severe complications.
We're talking about the population, the most vulnerable population, and are those patients that have any kind of medical background, especially heart failure, hypertension, patients with pulmonary obstructive disease, we call it COPD, and those categories are patients with emphysema or chronic bronchitis, patients that have diabetes, also patients that are on kidney failure, and essentially the patients that are on dialysis, patients with any type of cancer that are undergoing chemotherapy because the immune system is not strong enough to fight. And for some reason, as we know already, that's the population that are more affected, more or less 40 to 60 years as an average. You know. The most important thing we can do is trying to follow the instructions of the self-isolation and the social distance.
Not every person who gets COVID-19 will need hospital care. When health experts analyzed the COVID-19 outbreak in China, they noted that 80% of the confirmed cases are mild to moderate. These persons experience symptoms like we would get when we have a cold or flu. They did not require hospitalization. 14% of the cases were severe. These persons required treatment at a medical facility, specifically for oxygen. And the last 6% were critical. These patients required intensive medical treatment, which is why keeping the number of cases as low as possible is the goal.
The most important thing, and that everybody hopes, is that we don't reach the level that we need to have patients admitted to the ICU. Because, of course, even that the best healthcare systems, when we have this amount of patients, the health systems are going to be overwhelmed. Our only and most important option right now is trying to do all the prevention measures that we have, you know, and you essentially been listening from all the different social media and television that we need to essentially take care of ourselves initially and also take care of each other. That's the most important options we have right now.
Dr. Hidalgo echoes the message of all health officials that minimizing the spread of COVID-19 is essential.
One of the most concerning things is that the fatality rate of the virus, especially for the patient with comorbidities, and the reaction that we can have. Of course, despite of everything and all the information, as a human beings, of course, we react with fear because it's natural. But again, this is the time for us to get together. We need to. I believe together we can fight that.
The Ministry of Health has a hotline for information about COVID-19. Dial 0800 MOH Care.